Is everybody ready for me?
Yes.
Yeah? Okay, good. I'll wait. Hi over there. Hi guys, good afternoon. My name is Amanda, and I'm here obviously to do a presentation for you guys about Medicare. A couple things just to start off. There's a handout that Cassie had given you. Some of you have it. Some of you don't. If you don't, I apologize. My printer is, as you can tell by the printing, not the best printer in the world. So, but Cassie's going to email them out. But that's just really more of a reference for you to look at and review and take notes if you want to while I'm speaking. But it's not exactly the presentation I'm giving, but it's just more information for you guys. So I'm looking at the crowd and I feel like I probably have a good amount of Medicare experts here, right? That's why you guys are here. Okay, I know it's about as clear as mud when it comes to Medicare. So yeah, right. You're just checking on me. Perfect, perfect. That makes me feel better. So a little bit about myself first. So again, my name is Amanda. I've been in the Medicare business for about 3 years now. I've been in insurance for 6 years. Okay. Previous to going insurance, I was in banking for 25 years. I actually moved to San Diego 25 years ago. And was in banking for a very long time. It was a very stressful job, and I didn't want to do the hours or the stress anymore, and so I decided to go into insurance, which is not at all stressful. But in doing, I did benefits for employees, life insurance, disability, things like that first, and then really saw a need for help with Medicare. And just decided that that was the path that I wanted to choose. So, I live in Tierra Santa. I live right over. I'm so confused when I'm looking, but I live that way. I think in Via Martinique, off of La Quinta. I bought a house there, a townhome there. I've been there for about 5 years. I love Tierra Santa. I can't imagine living anywhere else. So yeah. So that being said, I'm going to go over the information. If you guys have questions about your individual plans, we won't get to that today, okay? But I can always come and meet you at your house. I'm a resource for anybody that's a member of the village. I'm happy to go over your plans with you if you have questions. I'm going to do more of a broad overview about Medicare today, though. And my hope and my ask is that if you guys have questions as I'm going along, interrupt me, raise your hand, ask me questions. I'll try to take breaks and try not to talk too fast because I have a tendency to do that. But please ask away because the reason for me being here is to be a resource for you guys, okay? And of course, I'm not the expert by any means, but anything that we don't know, I will absolutely work my best to make sure I get an answer for you, okay? So in Medicare, for myself anyways, I'm what's considered a broker. And what that means is that I represent multiple different providers when I'm doing Medicare. So I don't work for one company. I am able to set up plans for United Healthcare, Aetna, Humana, Sharp. Basically any plan that's available throughout San Diego County, okay? And when you work with myself, or when you actually work with anybody, and this is very important for you guys to remember if you don't know this, when anybody ever helps you with Medicare, you should never have to pay anything. We get paid by the individual insurance companies, okay? So that's something that's, you guys pay for your Part B when you have Medicare, so no one else should ever charge you for that. If they say there's a charge, it's a red flag, okay? Ask a lot of questions. But I will never steer anybody in any direction on any particular provider. I want you to make the decision that's best for you, okay? So let's get into it. So, who's on Medicare? Not everybody. You're not. I'm not. You're not. Okay. Okay. So and I hope I'm not over explaining things that you guys already know. If I am, I apologize, but I'm just going to go through it just in case. Okay. So, original Medicare Part A. So, as you guys know, when you turn 65, okay, you're eligible for Medicare. As long as you have worked for at least 40 quarters, which means that you worked 10 years, you're eligible for Medicare. Part A automatically is turned on for you. You have to set up Part B for yourself, okay? So, Part A covers just the very, very basics.
I need to take a little breather here because the presentation is not going across to the Zoom meeting the way it should. So bear with me a second.
The presentation's not moving along, so I have to stop for a second.
People at home want them along for the ride, for sure. Oh, and you can tell them that I also sent them the
Okay, perfect. So if the people at home can hear me, Cassie just sent you the handout as well for you to reference while I'm speaking. So is today supposed to be the hottest day? Oh,
Yeah. Easy.
I know, I know. That air conditioner is working overtime.
Yes.
My cat and my dog are just laid out. We're good now? Okay, perfect. Okay. So back to original Medicare. So Part A of original Medicare pays for just the very basics, okay? It's the hospital portion. So you get admitted to the hospital. It's going to cover if you have a bed and you have food. It doesn't pay for any of the additional things, okay? If you need to see a specialist, if you need to see an actual doctor, get an MRI, any of those things, that's where your Part B is going to come in. Part A, there's no cost for Part A. You pay for Part B, you don't pay for Part A, okay? So it's free to everybody. There's rare cases that people don't qualify, but for the most part, everybody qualifies for Part A. Now, Part B, yes. I'm gonna get there. Don't worry. Oh, for A, no. Well, yes and no. And her question for the people at home is if there's a deductible for Part A. It depends on the plan that you're on. Okay. And hopefully I'll answer some of that, but we'll come back to that too. Don't worry. So, Um, Part B is what pays for your doctor's visits, when you go and see your specialist. Basically, everything that is not covered in Part A is covered in Part B, okay? And so back it up. Part B, you do pay for, okay? Most people, the beginning part, the beginning starting amount that you pay for Part B is $185, depending upon your income. If you're thinking I pay more than that, you might, because it depends on your income. So if you're in a higher tax bracket, you might pay more than that. Lower tax bracket, you might just pay that 185. And that changes every year. It is going to go up in 2026. Don't know exactly what it is, but I don't think it's going to be significant as of right now. Okay. So that's Part B. The two of those combined together is just original Medicare. Okay. So with original Medicare, that's just Part A and Part B. Okay. Any questions so far?
I have a question.
Yep.
So I could say I don't want Part B
No.
and I wouldn't have to pay this 189 a month. It wouldn't take it out of my social security.
So great question. So the question was if you can opt out of Part B. So you can, but you have to have something else in place. So you need to either have insurance in place through your employer if you're still working, or no, you can go, yeah, yeah. And if it's a matter of cost, depending again upon your income, there's some other things that are available to try to take care of that, but it's based off of your income. Okay.
So if you had insurance, private insurance outside of Medicare, you could opt out of it.
Yes, you can defer Part B. As long as you're right. So like, here's a great example. Okay. A lot of times I'll talk to couples and the husband is still working. The wife is retired. The husband has them covered under his health insurance through his company. Then she doesn't have to go on to Medicare. She can defer it as long as she's still on his insurance. But you have to have something. Yes.
And you're obligated to pay B, whether you want it or not.
Well, it's like insurance in California. If you don't, there's a penalty. And the question was if you have to take Part B. So,
My answer is
yes, yeah, yeah. Okay. So those two combined again is original Medicare, and basically what original Medicare covers is everything that you see here and that I talked about. Medicare pays for 80% of what your medical expenses are, okay? You are responsible for the other 20%. Yes, in addition to that $185. And that's kind of where we're going to get into a little bit of the meat and potatoes on how you pay for that other 25% or that other 20%, okay? So now we go into Part C, and this is fun because there's all these different A, B, C, D. Part C is just Medicare Advantage. Okay, so when you do just original Medicare Part A and Part B, okay, you can let me back it up. You can go two different paths when it comes to Medicare. Okay, so you can decide you want to stay on original Medicare, which is just Part A and B, and you have to add prescription drug coverage. Okay. And I'll get there in a second. Or you can do an Advantage plan. Okay. Which takes A, B, and D and wraps it up into a nice little package together. Okay. And you just pay your 185, and then if you choose, depending upon the plan that you choose for the Advantage plan, there may be a monthly premium for that. A lot of times there's not, though. Most Medicare Advantage plans, there's no cost to them. But it depends on, the different packages that are available. You might pay a monthly premium, and that might offset some of your copays, things like that. But with the Advantage plan, it's basically wrapping all that together, and then you go within a network of doctors. So a part C Advantage plan is typically an HMO plan. Okay. So whether it be UCSD, Scripps, Sharp, Kaiser's another big one. I can't do Kaiser. Kaiser's like their own. Yeah, 100%. But a lot of people love Kaiser. It's a great company. And so you stay within that network of doctors. And so if you want to go see a specialist, you have to get a referral. You can't just go wherever you want to. You have to stay within that network just like you would any other HMO. That's an Advantage plan. You have a question, I could
I
tell.
do, because if I don't have an Advantage plan and I've got the same kind of coverage as that wrapped up into the Advantage plan. So if I didn't have an Advantage plan, I could go to any doctor.
Yep, I'm going to get there next.
Okay?
Yes.
Okay.
And it's an Advantage plan?
Yes.
Yeah, there are some companies that do offer an Advantage plan that's a PPO, but they're really getting away from that. If you have that plan, you luckily were grandfathered into that plan, that's great. But now when they're introducing new plans, that's really not the case. You can keep the plan that you have. They should never kick you off your plan. I know. And they should never kick you off your plan, but as long as they continue to make it available to you, you should be fine. Okay? Yes, ma'am.
Go from year to year unless you quit.
You should, and I'm gonna get to that in a couple slides too. You guys are so fast. I can't even.
I told you yesterday.
I know. You guys have so many questions. I'll get there. And anything that you think of right now, if I don't, when I get to the end, haven't covered it, ask away. But let me try to move through all that. So with the Advantage plan, again, you stay within the network of doctors. It includes a prescription drug plan, and you typically don't pay to have the Advantage plan. There's no charge, so you just pay that 185, okay? But you do have out-of-pocket costs. And the difference is a lot of times in the plan is that there's a maximum out-of-pocket or deductible that you have to meet that you pay for, and then after that, everything is covered, okay? And then with the original Medicare, I'm gonna skip here really quick. With original Medicare, so to answer the other question, so with original Medicare, it's basically a PPO. You can go to any doctor that you want to and any network that you want to. You don't have to ask for a referral as long as the doctor accepts Medicare, original Medicare, which most of them do. You can go wherever you want to. Okay. Now, if you do original Medicare, you have to set up a Part D plan, which again, Part D pays for your pays for your drugs, pays for your medication. And the plan that you set up, it really depends on what your needs are, what kind of medications you're taking, what pharmacy you want to go to. Typically, they're pretty inexpensive. They can be a little bit more expensive depending on the medication that you're taking. And whoever helps you, be it myself or whoever already helped you, should be able to kind of shop around for a plan based off of what your needs are and tell you. So original Medicare, you have to have a Part D plan, okay? So that's going to cover original Medicare, but you still, again, are responsible for that 20%. And so it's not like the Advantage plan where you pay a deductible or you pay copays, you just pay the 20%. So to cover that, to kind of fill that gap on there, you can set up a supplement plan, okay? Which is a Medigap plan. Who's heard of that? Does anybody have a Medigap plan? Perfect. Okay. Medigap plans are great. And so what that is that so again, and you guys, if I'm getting confusing, because I know it gets confusing, just raise your hand and yell at me. Well, don't yell, but so when you set up the Medigap plan or when you're on Medicare, that 20% with the Medigap plan is going to cover all of that 20%. So when you go to see a doctor, you're not going to pay copays. You don't have that minimum or that maximum out of pocket, or you don't have a deductible that you have to meet, because the Medigap plan will cover that, okay? But you pay for the Medigap plan. You pay a monthly premium for that. So when you think about yourself, and you're considering making changes, or if you're going into Medicare, some things to take into consideration, whether you choose to go original Medicare and add a Medigap plan, or if you want to go with an Advantage plan. I personally always start with your doctor. So most of us, by the time, I'm going to be 50 and I have my primary care doctor. I love my primary care doctor. I don't have any intention of ever leaving them. And I like my network. And so I start there. And so what do you want to do? You know, do you want to stay with this doctor, or are you more flexible? Another thing to keep in consideration also is, do you travel? So if you travel out of state a lot, some people go back and forth between Arizona, then you might want to think about which plan you're going to go into, because if you're on, say, for example, a Medicare Advantage plan that's through Sharp, you're limited to the Sharp network. Okay. Kaiser's a little bit more flexible. They're in more states. Where with original Medicare, it covers you basically anywhere that you go. Okay. What questions about that so far?
I have a question.
Shoot.
Is it your experience that most of the carriers that offer the basic A and B plans will also offer a Medigap plan?
Yeah, there's so many different Medigap plans, and that's a great question. So in case you guys didn't hear, he asked if most of the carriers offer a Medigap plan.
Speaking to the mic, they can hear me from you.
Yeah, okay. Sorry. I didn't think of that. Yes. So for example, Aetna has one, Humana has a Medigap plan. I'm pretty sure United Healthcare has one. A lot of insurance companies do, State Farm. I mean, you can purchase a Medigap plan really anywhere. It's just up to you what your preference is, and what company you choose. They might vary in premium, but they will not vary in what the coverage is. That's regulated by the government. So the best plan that is available for a Medigap plan is a Plan G, in my opinion. I'll say, in my opinion, the Plan G. And that covers basically almost everything except for your Part B premium of 185. You still have to pay that. And that's going to be the case with whatever company you choose. If you chose to go with Aetna, if you chose to go with State Farm, it's going to be the same Plan G regardless. They might add extra benefits to them, things like that, but it's going to be the same coverage. So there was something I was going to add to that. Yes.
This is Linda. I have a question.
Who said that?
Oh, sorry. This is Linda. I'm online.
Okay. Okay.
So the gap, does that cover out of the country, or would you still recommend travel insurance?
Perfect. That's what I was thinking I was going to say. Thank you. So Medicare and even the Medigap plan mostly only covers if there's an emergency. So if you travel out of the country, you have some type of emergency, you need to go to the hospital, you have an accident, you need to go to the hospital, it's going to cover just for you to get well enough to come back to the United States and finish getting treatment. Okay. Some of the Medigap plans have a little bit more, but if you're going to be traveling and you have concerns about your health, I would always say buy some type of travel insurance, because it doesn't cover it completely. No.
And second question, does Sharp have a gap plan, or just just the Direct Advantage?
I'm not actually sure. I can, if you want to. Yeah, she can. I'll get your email from Cassie, and I'll send that out.
Okay, thanks.
Can I call you Cassie?
Yes, I asked, I answered all of it.
Okay. And then you had a question.
I know you don't want to deal with Kaiser today, but could you throw out a little gem here and there about Kaiser? Do they have their Medigap program?
Yeah, it's not a matter of me not wanting to deal with Kaiser. It's just that Kaiser doesn't contract with brokers. So that's the only reason. But I do know a good amount about Kaiser. And they do have a Medigap plan. Yeah. And you should be able to go to any Kaiser, or they have representatives specifically for Medicare questions within Kaiser that are very, very knowledgeable. Anything else? Yes, sir.
Remember through scripts.
Oops, hold on just a second. She's going to bring you the microphone.
Remember through scripts. And we're on our second policy now because it got canceled out.
I'm gonna get there
Because the
too.
Advantage don't pay enough money to the hospital. Is that true?
So I'm gonna skip ahead because you're asking this question. So, scripts, well, here, we're just gonna go off however we're gonna do this. That's okay. I like it too.
Living on the edge.
Okay, so to answer your question, and then I'll come back to this, but so San Diego County is unique, okay? 2 years ago, I think it was 2 years ago, Scripps Clinic and Scripps Coastal decided that they would not accept Medicare Advantage plans any longer. And that is because of billing purposes. That has nothing to do with me, nothing to do with you. They just decided that they weren't going to deal with it. They would only deal with Medicare, original Medicare. And I don't know how it's going to look for 2026. I do have an idea that there may possibly be some more changes like that, but I don't know what it's going to be or who it's going to be. But there are a lot of providers, a lot of networks that don't want to accept Advantage plans. They want to go directly with original Medicare. And so what happens is that if you're in that plan, you have to make a change. They give you sufficient notice, okay, to make the change. I'm sure you were made aware of it well in advance, so that you know that, but you would have to make a change. And that really, I mean, honestly applies to anything that we buy. They can make changes whenever they want to, unfortunately. But it did disturb a good amount of people in San Diego because there's a lot of people that were on scripts. So, yes.
If they're taking original Medicare, isn't that what they've been getting? They've got our original Medicare and we pay them or not, the Advantage plan.
It's billed differently. So with Medicare, with original Medicare, they typically, the doctors will bill Medicare directly. Okay. And so a lot of times when people that are who's on original Medicare? Okay. So if you've ever had to use your original Medicare for something that's substantial, you get all that information in the mail, more than you probably ever want to see, of how much is being negotiated, how much is paid to the doctors, things like that. When you have an Advantage plan, their doctors are working with that network that then bills Medicare. So it's a little bit of a different process that they just decided that they didn't want to go through. Yeah. Anybody else? Okay. Okay. Cassandra. But that being said, I do want to make sure that we cover this. So open enrollment every year is October 15th through December 7th. Okay. So there's two open enrollments that you need to know about. So October 15th through December 7th is for open enrollment for everybody. Okay. And then there's a Medicare Advantage open enrollment every year from January 1st to March 31st. So the difference is the second one, you can go in between Medicare Advantage plans. So let's say you're on Medicare Advantage and you go through UCSD. I don't like them anymore. I want to go with Sharp. You can make those changes pretty much that entire period, starting from October 15th to March 31st. Okay.
Go back to original Medicare if we wanted.
You can go back to original Medicare, yes, but only during October 15th through December 7th. So that's the one where you can go in between original Medicare and Advantage plans. So, and that's every single year. And then there's certain special circumstances when there's, fires, things like that, that allow you to make other changes if necessary. But that's really when the open enrollment is. When you turn 65, you have 3 months before and 3 months after to enroll. Okay. And then if you decide that let's say that you decide that you're on an Advantage plan and you want to go back to original Medicare and you want to go on a Medigap plan, you have to do that in the month of your birthday. Easy as can be to remember, right? Oh, that's super easy. That's why you have me. So just remember, I know. So just remember October 15th, December 7th is open enrollment. Okay. Yep. If you want to make changes or change your options on Medigap, that's your birthday year. Okay. And then the first quarter of the year is to change Advantage plans. It's really, and so going back to what we had talked about, It's really important that you guys read the information, unfortunately, or call me. That's why you guys have me. You guys will get my cell phone number. I don't mind helping you. That's why I'm a part of the village, just so that I can be a resource and help. But it's really important that you understand the changes that are coming up every year on your Medicare plans, because they do change. And we don't know what's going to happen. As of right now, there's a lot of negotiating that's happening for the plans for next year. And so we don't know what it's going to look like. So make sure you open your mail, make sure you have somebody, and if it's not me, that's okay too, but make sure somebody reviews your plans every single year. Because in addition to those changes, a lot of times, people get stuck in a plan. What did I write down here? Hold on. People get in a plan, and that plan kind of becomes outdated and doesn't offer a lot of the perks or benefits that some of the newer plans have. And there are plans that have better perks and benefits that are available to you. And so you really want to make sure that you talk to somebody about that every year. Um, I said always review your plans during open enrollment. Things change. Medical in general, they make money when you don't know. And so if you don't know, then that's a problem. You want to make sure that you know. Yes.
And I think the drugs change here, so it might be
Mhm.
covered 1 year into a certain year, but
Mhm.
for drug.
Yeah. She was asking about the drug tier coverage. So drugs, medications, there's different tiers based off of the type of medication it is, the level of medication and cost, and that changes. It's a formulary that they use. It's also very clear and not confusing at all. But that can change every year, and so you want to make sure that you review that as well. And you can change your drug plan too during open enrollment. Okay? Yes, of course. Ask all the questions you guys want.
Decide what tier of medicine you will have. Who decides what tier of medicine you're going to have? Is it the doctor? Is it the pharmacist? Is it you or what?
Well, it's the tier of medicine is more the level of the type of drug that it is, and that's really going to be your doctor. The way that the costs affect you is whether or not you can buy a generic or if you have to buy the original.
But they don't even ask you. Most of the time they give you generics.
Right. Yeah, they're always going to offer the generic because it's more cost efficient, but you can ask. Yes, of course. Yeah. Anything else? Okay. Okay, so I'm going to go back a second here. And I want to talk a little bit about what's not covered under Medicare. Okay. And this is a lot of information as well, but I think it's really important. I think this is the piece that most people miss, unfortunately, with Medicare and understanding costs when it comes down to you. So, Medicare only covers short-term skilled nursing. I'm going to go into that in the next slide in a little bit more detail. Routine dental care. It covers routine dental care and emergency dental care. So just a checkup. But if you decide that you need to have a crown, things like that, or any type of additional work done, you need to have some additional dental insurance. Okay. Again, like we talked about, overseas medical care, it typically only pays for if there's an emergency, and then for you to get back here, which you would pay obviously on your own to get yourself back here, but it pays for what needs necessary to get you back up on your feet and get you home. And then long-term care, custodial care. So when I say long-term care and custodial care, there's a couple different things to think about. So, and this is where I'm going to go into a little bit more of the weeds on how you pay for hospital. But when you go into the hospital first, okay, as you can see, Medicare covers for days 1 through 60. You don't pay, Medicare covers that. You're covered days 1 through 60, okay? After you hit your deductible, and again, that depends on the plan that you have. Some plans may have like a $3,000 deductible. That just depends. And then it's after that, it's covered. Days 61 through 90, they pay $408 a day, which isn't going to cover a lot in the hospital. And then days 91 through 150, 816. Okay. I know this is never a fun thing to think about or talk about, but I think it's important to know. Hospice is completely covered under Medicare. You don't pay anything for hospice. Hospice is wonderful. I'm sure everybody in here has had some experience with it. I definitely have had my fair share. But all costs are covered. They also offer some additional things like grief counseling for your family members, things like that. And you can cancel hospice if you wanted to. And you don't have to pay that back. And I think that's important to remember too, because I think that people are afraid that if I go into hospice and then I get better and come out of hospice, am I responsible for that bill now? You are not. Okay. So that. But when you go into the hospital, okay, so now you've gone into the hospital, let's say you broke your hip. Okay, they've got you all ready to go. They're going to send you back out, but you can't still take care of yourself and you're on pain medication or you're on some medications. Okay, your doctor has to put you into a skilled nursing facility, and that is covered underneath Medicare. Okay, but if you go into an assisted living facility, which is different, or if you have home health care, that is not covered. Okay. So skilled nursing is exactly what it sounds like. You have a nurse that's going to hand you medications, that's going to, help you with all the things that you need. That's the purpose of a skilled nursing facility or like a rehab, and that is covered. Okay. But if you decide that you want to go into or move into an assisted living facility, or if you want to have home health care, you pay for that 100% yourself. Okay. So it's really important that you guys talk to, be it your financial advisor, anybody like that, and look at options that are available to you there for long-term care coverage. The majority of bankruptcies for people that are over the age of 65 is because of medical bills, and I don't think that surprises anybody. I mean, if you can imagine, if you get stuck into the hospital for 3 months, it's going to get very, very expensive. And so making sure that you have some type of plan in place to make sure that you have the ability to pay for the care that you want is really important. A home care person is typically about, in San Diego right now, $40 an hour is what you would pay. And so there's a lot of options that are available because you will use all the wealth that you've accumulated your entire life to pay for this if you don't have something in place. So I want to make sure you guys understand that, to make sure that you have something that you've thought about or you do think about to have that covered for yourself so you don't lose all that money. That was a lot. Yes.
For the days, are they cumulative or is it per incident or per year?
Go ahead, you can ask again so they can hear you.
The days that are listed up there, day 1 through 20, and on the previous slide for the hospitalizations, day 1 through 60, is that per incident, or per stay, or is that a cumulative over a year or your lifetime?
That's a good question, actually. That's a good question. I would assume it's your lifetime. No, maybe not. Yeah. Per incident? Okay, I'll find out and I'll send out. Yep. Yep.
Hi, this is Linda again. I have a question.
Yes.
Does any of the gap cover like home health?
No.
No.
The gap unfortunately does not cover home health care. It doesn't cover home health care or assisted living. That's why I want to make sure that I think a lot of people are surprised by that, but it's Medicare in general will not pay for, and the Medigap plans are ruled by Medicare.
Okay, thanks.
I have a question too. Also, they don't cover rehab, right?
Yes, rehab is covered.
It is.
Medicare covers rehab. Yes, that's why when I was talking about,
Mine wasn't covered, but I was 60 days in intensive care and in the hospital. So after the 60 days, they paid a few pennies and then I was responsible for the rest.
yeah, that's a lot of that's going to depend on what your doctor says. So your doctor has to make it so that you have to go into a skilled nursing facility and then it's covered. But if they say, no, she can, for the most part, take care of herself with she might need assistance getting up and getting in the shower and things like that, that's not going to qualify. That's going to fall back into a caregiver. And that's not covered. So that it really depends on what your doctor says. Does that make sense? Yes. Okay. I'm writing myself a note. Anything else? Okay. So, okay. So, I thought you guys were gonna have way more questions than this. We're doing good. Yeah. So things to remember, again, I want to make sure that I emphasize this for you. Anyone who helps you enroll in Medicare shouldn't be charging you. Okay. red flag. I don't think that that happens very often, but I also have people a lot of times that will say, oh, how much do I owe you? You don't owe me anything. Don't get pigeonholed into one provider. So just don't explore your options. And also too, a lot of things, something to remember is that a lot of times your doctor, because again, I always focus on the doctor first, may accept different types of insurance through Medicare. So you don't have to be on a particular plan or through a particular network to go see that doctor. Make sure you explore those options as well. And then if you are turning 65, which there's a couple of you, when you do turn 65, you would have a long time. I'm sure you have a long time too. You get bombarded with information. So it's really important that you have someone in your back pocket that's available to you. That's what I'm here for. If you have people that you know that are turning 65, and then also open enrollment too. I mean, there's a lot of, I'm sure, information that comes to you guys. So just try to go through the best of it as you can, but make sure you have somebody that you can ask questions to, okay? So a couple of last things that I want to talk about, and then you guys can ask whatever you want. Let me make sure I got everything I need. Yep. So that's my cell phone number. You guys can write it down.
Is it okay if I pass these slides on?
Yeah, of course.
That's great. So they
Of
can
course.
refer to these.
Yeah, of course. So there's a couple of other things that I want to talk about really quickly. The first one, does everybody have this? Yeah, okay, good. And for the people that aren't 65 yet, you can go on to Medicare.gov and you can order this. This is a huge resource for you. I mean, it has all the rules and everything else. Nobody expects you to understand it. That's why you have me, but this is what I use, you know? But this is what I use. This is what I look through to get all the information. So you can go to Medicare.gov, get this, and this should be sent out to you every single year during open enrollment. But if for some reason it's not, you can always go on and order it for yourself, okay?
Is that the one that's put out by United Healthcare?
No, no, this comes directly from Medicare.
Okay.
Yeah. United Healthcare probably sends something else out if you're on their plan.
AARP they do, and
Yeah.
that thing's on a short novel as well.
Yeah, yeah. And the handouts that I gave you guys, it was originated by United Healthcare, but the information is just general information about Medicare, okay? But this comes directly from Medicare, so this is the rules. This is the Medicare Bible. So that's the first thing. And then there's a lot of benefits. I was actually looking last night that are available because Cassandra and I had talked about this. I'm just going to call her Cassie. I don't care. And had talked a little bit about, some of the benefits that I want to make sure that you guys know about that's available through Medicare as well. So who knows about silver sneakers? Okay, perfect. Good. Okay. So silver sneakers is typically available through an Advantage plan, but some of the Medigap plans also offer it as well. And what it is it's a free gym membership that's available to you. So you can go through LA Fitness. I put my glasses on now. Planet Fitness and the YMCA all offer a free membership for anybody that's on Medicare. Okay. And you can actually go to the website, which is silversneakers.com. And you can find out if you're going to a different gym, you can see if that gym that you're going to offers it. If not, you can switch over to one of the other ones and they offer that free membership. A lot of times they'll have specialty classes, things like that are available also. And then yes, ma'am.
If I'm only on A, it will cover it?
No.
You have to be in.
You have to be on an Advantage plan or a Medigap plan. Original Medicare doesn't have it. Oh, got it. Yeah. And then something else I learned last night is that when you are released, and this is something that they don't ever talk about, but when you're released from the hospital, you can request to have meal service delivered to you for up to 14 days, and they'll deliver meals to you up to 3 meals a day for up to 14 days after you're released from the hospital, which I think is very helpful. Yeah, which I think is very helpful because obviously you're getting home from the hospital. The last thing that you're thinking about is cooking.
Is there contingency about how long you're in the hospital or if it's overnight?
Not that I saw. I read through it last night. I did not.
It's overnight, it's still.
Well, I would say admitted, so at least 24 hours. It says admitted. So if you just go in because you broke your foot and they send you home, no. That would be nice, but yeah. And so that's another thing too. And so I'll send that information out or send it to Cassie that she can send out to you guys as well. And I'm going to continue to look for things that that are a benefit that we don't always know about through Medicare to share with you guys so that you can get that information and take the most advantage of it you can. You pay for it, and I want to make sure that you guys are using it. And so I said Medicare.gov. You can go to the Medicare.gov website. I know it's very exciting. I'm sorry. I feel the same way. Don't worry. When I have to do my annual training, I feel the same way. When you go to Medicare, you go to Medicare.gov. You can go to Medicare Plan Finder and research plans on your own if you want to. The plans are all by zip code, so what's available in 92124 might not be available in 92115. So you can do research on that on your own if you want to, or you can obviously always call me. And then SSA.gov also has a lot of information on Medicare. So, and that's 45 minutes of me talking. I'm gonna get a sip of water while you start asking me questions.
And for those that are helping parents or other folks that may need assistance, what is the term that's used to that someone can give another person permission to assist them on the website? Isn't there
A power of attorney, medical power of attorney?
something else?
Proxy.
About it the other day. No,
Is it Medicare specific?
I believe so.
Oh, like an authorized representative?
Yes.
Okay, yeah,
Authorized representative.
yeah.
Can you speak to TRICARE for Life?
That's a great one. I honestly, TRICARE is still something that I'm really learning a lot about. But TRICARE for Life is for people that were in the military. Government employees also have additional plans that are available to them. I can send out information, but I don't know a whole ton about it. You can still go on to, my understanding is you still can go on to Medicare. You can go into Medicare and TRICARE, or for government employees, it's FEMB, acts as co-insurance along with that. So that wasn't very helpful, but I can send that out.
Yeah.
Okay, good. Are you on TRICARE now? Okay, I'll absolutely.
They don't make it easy.
No,
to figure
I'll absolutely find out for you. But I think TRICARE is actually in the book too.
Oh, okay.
It talks about TRICARE in there as well. So, also being in San Diego, a lot of military. So, what else? Yes, ma'am.
Not Medicare, but perhaps you, the wise person, that you
Oh, no.
are well trained in answer this. Occasionally, I get through online offers about or suggesting that I sign up for certain things that is death benefits. And right now they're saying that you're entitled to $25,000 as a death benefit just by signing up. Do you know anything about that?
So that's not anything that has anything to do with Medicare. Okay, just so you know.
Yeah.
Yeah, that's not anything that's offered by the government. And I'm sure that you guys probably get all those things in the mail all the time, but that's life insurance.
That's supposed to be coming from Social Security, is what they're representing.
I'd like to look at it.
I'll try and find it on my
Okay.
phone.
Yeah, there's not, to my knowledge, anything that's offered through, there's a lot of companies that will offer life insurance, things like that, and say that they're Social Security certified, which there is a certification that you can get, but that doesn't mean that the plan is coming from Social Security. You're still buying it from an insurance company. What else? What about my people that are on Zoom?
I have a question.
Yes.
I'm on Zoom.
Hi.
Hi, I'm Sheila. I have United Healthcare and Medicare.
Mm-hmm.
Is Medicare my secondary or my primary, or is United Healthcare my primary and Medicare is my secondary? And should I reverse them?
Okay, so Medicare is your primary, and United Healthcare is just the provider of your plan. So Medicare is your primary, unless you have a Medigap plan.
No.
Okay, then yeah, you most likely have an Advantage plan that's through
I do.
Medicare.
Yeah.
So your Medicare is still your primary.
Okay, thank you.
You guys are easy.
Understand what is Medicare?
So,
What is
so,
Medigap?
yeah, so sorry, the question is, what is Medigap? Do you have a Medicare Advantage plan? Okay. So rather than having a Medicare Advantage plan, you would have original Medicare where you can go wherever you want to. And then you buy a Medigap plan to pay for that 20%. Okay. Do you pay for your Advantage plan? Okay. I love it. I know, all the time. I would be happy to look at your plan and I could tell you. But so for you, a lot of times if you go to the doctor, you probably have a copayment. If you were to go to the emergency room, you're going to have some type of copayment or a deductible. And you have a maximum out of pocket every year that you need to meet before everything is covered. That's the case with an Advantage plan, where with a original Medicare and a Medigap plan, all that is covered. So you don't pay co-payments, you don't pay any of those things. However, you pay a monthly premium for that Medigap plan. You do not pay for that for the Advantage plan.
I mean, the issuer of the Medigap plan bundle the premium into their into one-stop shopping.
No.
So that goes to the government and you get a separate invoice
Yeah,
from the
for the
carrier.
the 185 typically comes out of your Social Security, or you can also receive an invoice, but for the Medigap plan, you pay for that separately.
Medigap money you would pay for Medigap, does that go to the
No,
care?
no.
That's like an Advantage plan,
Yeah, everybody pays for the Part B. Everybody pays for that.
right?
Yeah,
So Medigap though is like another insurance company.
correct. It covers that 20%, but the 185 that you pay is not part of that 20%.
It's not what?
It's not part of that 20%. I feel like I lost you.
You
I know.
lost me, yeah.
So, yeah, the 185 separate from that 20%. So let's say,
Got that.
yeah.
Got that.
So, but the Medigap pays for that 20%. So let me see if I can use an example without making it worse. So let's say that you go to the hospital and you have an outstanding bill of, let's say $100,000 for easy numbers, okay? So you go to the hospital, you have an outstanding bill of $100,000. You receive a bill for $20,000 because you're responsible for 20% regardless, okay? So now with the Advantage plan, okay, let's say that your particular Advantage plan, and this is not the case with all of them, so don't take these numbers at heart. These are just examples, okay? Let's say that your Medicare Advantage plan had a maximum out of pocket for the year of $8,000, okay? So now you're going to be responsible for paying $12,000. Or no, I'm sorry, you're going to be responsible for paying just the $8,000. They pick up the $12,000, okay? Because you now have hit your maximum out of pocket for the year. Everything else is going to be covered outside of co-payments, okay? Now, if you have a Medigap plan, they're going to pay that $20,000. You're not going to pay any of it. However, you've probably been paying a couple $100s a month, every single month for that Medigap plan. And so that's why it's really important to think about if you're somebody that doesn't have a lot of needs, but whoever knows when you're going to, right? If you're somebody that doesn't have a lot of needs, having a Medigap plan may not be the most cost efficient, but it does have a lot more coverage. So, did that help? Okay. Okay.
So this is Linda. So can one spouse have a gap coverage and one spouse have Advantage
No, it's per person.
per household or?
No. Oh, I understand what
Should
you're
my
saying.
husband have a gap coverage, but I have Advantage coverage?
Yes, that's fine. That's fine. You don't both have to be on the same thing.
If you don't have a gap plan and then you become older and you need a gap plan, can you jump into it?
That's a great question, and I'm surprised I didn't cover that. That's a good question. So a lot of times, a lot of the Medigap plans have medical underwriting. So if you're going to go into Medigap, it's important to do it while you're younger and you're healthy. because as you get older and you have more health problems, there is medical underwriting, and so you may not qualify. Yeah, and so when I'm talking to people that are turning 65, I strongly suggest that they think about a Medigap plan then. But of course they don't want it then because they're healthy. But because if you've in the next 10 years had a heart attack, it's going to be harder to get on the Medigap plan. So you do have to go through medical underwriting, yes.
So this is Lynn again. So if you already have significant health issues and you're trying to get a gap plan, they could decide not to cover you.
They could deny you, yes.
They could deny you.
Yes.
And then you'd get stuck with an advantage plan.
Yes.
Okay.
Yeah. That's why it's so important that that's why I'm here, that you guys understand, and I try to keep you as educated as possible so that you don't run into those situations. But yeah, that's correct. What else? Okay, so I'm ready to take a deep breath with me. That was a lot of information. I know. And I mean, I hope it was helpful. I hope it was a lot of information. I hope that it helped clear some things up. I know it's not the happiest conversation, and you leave knowing that there's going to be medical costs, but I just want to make sure that you guys are aware. And again, I'm a resource to anybody that's with the village. Yes.
Amanda, actually, I just wanted to let everybody know that you're helping me personally with long-term care
Yes, I am.
decisions. So
Yeah.
you're also a great resource to clarify all those options as well, whether it's standard long-term care or linked to insurance or annuities or whatever it may be.
Yeah. Yeah. So you guys can reach out to me with any questions that you have. So, and I'm here to help. So my phone number is on the slides. I know that Cassie's going to send that out to you. And then you guys have that presentation. But if you think of anything, please, I mean, if I don't answer right away or you leave a message, I'll call you back absolutely within 24 hours to help you with whatever I can. So
Thank you, Amanda. Thanks.